Hi, I'm Dr. Alka Banker from India, Ahmedabad, and my startup is Easy Braces Private Limited. The products are meant for dentistry. The main product is a bracket system or braces called BaTR bracket system. So in my 40 years of practicing orthodontics and seeing so many patients and so many problems, I found a niggling problem that what I envisioned for the patient, the end result does not reach there. Being a perfectionist, I wanted what I had in mind to be translated into the patient's mouth. Now each tooth has 3 planes of space, the X, the Y and the Z. And the tooth has to be situated in that exact position. The current bracket systems available in the market are all of the same prescription. That is one size fits all. So you can imagine if there is a shirt in the medium size which we have to fit the whole populations. Would it fit? It might, but there is always a big compromise. In the same way, a one prescription bracket system for all countries, all patients and all malocclusions. So there is always a compromise in the end result. Now this is the age of customization. You cannot have one size fits all in this day and age. And we started looking out for a solution. The current answers or solutions in the market are 2. One, the traditional one, which is where you bend a wire, arch wire, and then you put it in the mouth. Now this has 3 problems. 1, it is very difficult to bend an arch wire without canting it or disturbing the rest of the teeth. 2, it uses up a lot of chairside time of the doctor and the patient. And 3, it is very painful to insert this torqued arch wire in the patient's mouth. Frequently, the bracket debonds. The patient has to come frequently, and sometimes this is not possible. So the new age solution is the digital or the robotic braces, where you scan the patient and send the scan to the lab and get each and every bracket customized. Now no doubt this is very precise, but it is immensely expensive. You may not be able to give the benefit to all your patients. Second, it is dependent on a lab in a far off city. So there is a long time gap between the time the patient comes to your clinic and he gets the braces. And third, what if the patient breaks or loses a bracket midway? So you have to do the whole scanning and sending it to the lab and waiting for a month and receiving it. So the treatment gets delayed. So both options are not meant for us. One is too imprecise and very time consuming. The second is too expensive and dependent on a lab somewhere. We need to find a solution midway between the two. So it's easy for the doctor to deliver the precision, it's not so expensive for the patient, and it's not time consuming at all. And this is our solution in the form of BaTR bracket system. BaTR stands for brackets with variable torque and rotation. So a bracket is, we have made a bracket with 4 legs. When you bend the legs and you attach it on the tooth, you get a torque in the form of certain degrees. When you fold the legs and join it to the tooth, you again get a torque in a lesser degrees. So we give 6 different torque degrees in a single bracket. A single MBT torque plus 3 degrees higher and 3 degrees lower. No other bracket system in the world gives 6 options of torque in a single bracket and 6 options of rotations in a single bracket. There are many benefits and we will go through it one by one. It is very easy to bend the bracket legs and just stick it on the tooth. There is no learning curve. Even a general dentist, a beginner or unskilled person or somebody in the rural areas can manage to use it. In deep bite retrusive cases, you just bend the gingival legs and you get a nice root palatal torque. In crowding cases, in cleft cases, it's impossible to bend the arch wires for so many teeth, but it's very easy to bend the legs in a BaTR bracket and get individual tooth torque. Because you do it from the first, your torque and your rotation start getting activated from day one. Your treatment time and your finishing is very less. The patient does not need to come frequently to change the wires because everything is built into the system. In extraction cases where you expect there's a lot of torque loss or there's a rotation, you can give anti-rotation bends and anti-torque bends in the bracket system. And lastly, all this precision is at the same cost as your normal bracket system. So you are getting precision with time saving at the same cost of your normal MBT bracket system. So it's a win-win situation for all of us. Thank you.